This video is made for you, the practitioners of Chinese medicine, especially the experienced ones. The more experienced, the better. Because I'd like to share with you something that I think you would appreciate. We've been working with people with gallstones for the past 30 years. We have a protocol that's based on many of the classical protocols out there, but it's been honed by us over thousands of cases to perfection. And we've been working at it as a duo, my wife and I, over all these decades. And at this point, it's very, very clear to us that A, we can't leave it to go into the grave with us when eventually we'll be done here. So that's one reason why I'm making this video now. And the second reason is that after researching what's going on in the world, I've realized that the situation out there is sad because most people do not have a holistic solution that really solves this issue available at hand, which is something that I find unacceptable. So it's time to open up our very unique process to the world. And I would expect you to ask, but why Chinese medicine practitioners? It's not really a Chinese medical procedure in its essence. If anything, it's more naturopathic. But the truth is that one of the lessons I learned way back when I just started using the system on myself, I actually came out of the first run pretty down. I paid the price for what was obvious at the time to be spleen qi deficiency and probably spleen yang deficiency too. And that was a very uncomfortable thing to have. And since I was a student of Chinese medicine at the time, I immediately connected and correlated the two and realized that this kind of gallstone flush procedure must have a safety procedure to back it up. And the safety procedure is the Chinese pulse as a diagnosis, coupled with acupuncture, Chinese herbs, and many other tools that are outside the Chinese realm that can be combined to do pretty decent work of preventing such an occurrence in the future. And yeah, we've been having patients starting from the age of 8 and even as old as 86 that went through the process. And because of this understanding, because of the use of the Chinese pulse as call it a gateway, to get into the process, they have to pass the test. They have to be strong enough in the spleen so that I know that they can handle this process comfortably without any repercussions. That is practically the only thing that I consider dangerous about this, that it could just weaken you greatly if you enter this process with a weak spleen. So that's why I'm turning to Chinese practitioners, because teaching practitioners, naturopathic practitioners or any other practitioners, how to take the Chinese pulse is a lot harder than, upgrading whatever Chinese practitioner would need in other fields. I'm sure you'll agree with me. So that's the main reason why Chinese practitioners, and it will still leave a bit of a challenge because the kind of sensitivity to the specific levels in the pulse that I work with is something you need to teach. It's not part of the classical Chinese terminology anyway. So it's still a bit of a challenge, but a lot less than it would be if I actually had to teach a naturopath Chinese pulse. Another question that comes to mind is, why would a Chinese practitioner even need this protocol? I mean, we have gold coin grass and we have acupuncture. Why should we need this? Well, as a Chinese medicine practitioner myself, I can tell you that the dangers of using herbs or acupuncture to actually flush the gallstones spontaneously are pretty high. It's the same with Western herbs for gallstones and many other modalities I've heard of so far or tested. They all lead to the same danger of a stone being lodged in the ducts. Because if there's no process that makes sure that doesn't happen, why wouldn't it? Just needling someone to the point that the gallbladder is squeezed and the liver is squeezed, and and they spout out the stones into the ducts without all the necessary surrounding procedure, will very likely cause pain instead of resolution. And that's one of the reasons why I use acupuncture and herbs for tonifying and preparing the patients, and sometimes they need it for relieving acute pain, etc. But when it comes to actually dealing with this, the two important things that are needed here is the flush itself done correctly. There's no substitute that I found so far worthwhile. And there is the need for preventative measures as far as diet, hydration, etc. And that's what I use as a cocktail of Chinese, naturopathic, and many other modalities to actually get the picture thorough enough so that people can, like myself, be 30 years after they've flushed with zero repercussions, no pain, no echoes in the ultrasound or anywhere else to show for stones. It's 100% effective when it's done thoroughly. Now, when we realized that it's time to go and share this with the world, we actually did a few important things already, even before approaching you, the practitioners. We built a community, bilingual, because our natural crowd here from Israel is Hebrew speaking, but we wanted the world to be, able to use this system, so it's English and Hebrew. And in that community, there are tools that can help a patient go through this process much easier and smoother, such as a cookbook with recipes that are fit for people with gallstones to prevent gallstone attacks, and even a chef bot that can translate their own recipes into safe recipes, which is very fun to use. It also means that we have a whole course in English how to go through this process for the patients, so that they don't have to rely only on what we orally teach them in preliminary sessions. So it's actually the whole system already sitting inside a community, so that anybody who wants to jump on the wagon doesn't have to invent the wheel. We literally have everything ready, and the process can run. And we've already been running this internationally, over the web, over Zoom, and it's worked beautifully, and it's really good news as far as I'm concerned for the millions suffering from gallstones nowadays. P.S. I just realized I might have missed an important point here. We're not looking for people to be all in, drop your clinic and just jump aboard or anything like that. Don't get me wrong. If we're looking for experienced practitioners, then obviously you probably have a running clinic. I'm kind of counting on that, because otherwise, what kind of experience would you have if you had 20 years of a diploma but you haven't been practicing? I'm actually counting on professionals to join us exactly at the amount of time they have spare between clinics. If you have 4 hours a week, if you have 10 hours a week, or if you actually want to jump all in, it's probably going to be plenty of work. But it doesn't have to be all your clinic for it to be relevant. So even if you're curious, hop on board.